decades of research with Two-Spirit, trans, and queer communities that we face higher rates of mental health issues. And that can include anxiety, depression, body image and dysphoria, and being able to respond to these issues, which are not new, but have actually been made worse as a result of COVID-19, means that our communities need to be at the forefront of the response in addressing these issues. So the project involves 3 core activity streams, and they're all sort of meant to feed into each other to support this overall goal of building up community-centered responses to us LGBTQIA+ mental health. So the first is we're trying to mobilize and engage with community-based research that speaks to the mental health needs of Two-Spirit, trans, and queer communities. And then putting peers and people in our communities at the forefront in terms of defining what actions, what recommendations, what priorities need to be distilled out of this work. So the second core activity stream in the project is to develop, adapt, implement, pilot, and then evaluate a national peer-led community-based research, skills building, and capacity building intervention called Investigators. The project is involving 6 different local sites for this peer-led capacity building program.
Our program specifically was more focused on looking at the experiences of young, gay, bi, and queer, cis, and trans guys, to have them think through what are the problems, what are the issues, what are the concerns, how did COVID impact their mental health, the people around them, the people they love and care about, the people in their community, and to work with them on how we could consider developing some resources to address the longer term impact of COVID on the mental health of these queer communities. What we're hoping to do from this is to actually take the interpretation of some quantitative data and then create from that an artistic and creative output.
So the third activity stream for this project involves trying to develop and scale up different effective resources for service providers and community organizations. So that includes developing and evaluating a national bilingual online to us LGBTQIA+ knowledge hub. Plain language, accessible information and tools on to us LGBTQ+ mental health that can better support the needs of different members of the overall sector.
Working with this program and engaging with the participants is the best part of my job. It's the highlight of my week. It's the highlight of my job. And the reason for that is because I'm not the horizon of what is going to happen around addressing mental health and wellness for queer communities. I'm maybe the present, I'm certainly some of the past, but the people in this program, they are the horizon, they're the future.
You know, one of the reasons why I'm in this role is because I've gone through programs like Investigators that have, given me an opportunity to actually engage meaningfully in this work, and so that's part of the reason what motivates me in this work is, knowing that I personally have benefited from these peer-based, community-centered approaches and strategies around how we address these big issues like mental health systems and services that don't meet our needs. Making sure that our communities are centered in this response and at the forefront in this process of pushing for social change, pushing for a system that works better for all of us.